you've noted in the past that removing overnight calls for in-office clinicians
Hmm.
is a rare benefit in primary care. In the years since implementing e-visit, have you seen a measurable decrease in your recruitment costs or time to hire for new clinicians and nurses? And this is one of those where I do have a bonus question as well. Can you talk a
Awesome.
little bit about how you're helping clinicians avoid burnout?
Yeah, I gotcha. So there's a lot to unpack there again. Again, we exist as an organization in a kind of a hybrid space where we have a dedicated telemedicine team that is in remote setting, work from home. Our leadership team is scattered over like 5 different states. Our clinicians live in multiple states. They hold licenses for multiple states. But we really, when we bring enterprise telehealth to a market as sort of a new feature of a market, again, as I discussed previously, there's value-based care that has to be sort of communicated, strategized around, because most of our practices that we've worked with are fee-for-service practices. They're not used to value-based care, so we really have to sort of bring ourselves into market with that kind of coeducational piece to let them understand what we're doing, why we do it, and what the ultimate goal is of adding enterprise telehealth. Um, and what we find, friction points often are moving away from that model where it's uncomfortable for them to realize that we will be seeing patients that they would otherwise be seeing in the offices, and they see that sometimes as cannibalization. They see that as again, sort of like risk to their business, risk to their practice, risk to their KPIs. Um, and what we come back with is more data around what we talked about earlier, Jeff, like where would you have gone if KidzDocNow is not available? And we can comfortably show off the cuff that 30% of the patients would have gone somewhere else. They wouldn't even have come to us. And then about another third of the patients say they would have done nothing at all. So again, we're looking at really maybe about a third of those patients would have went to the office, but maybe they didn't necessarily need to go to the office. And some other things that they might have done would have been to make a phone call to the office and leave a message for their clinician to call them back. And when we talk about jammy time, those are the type of things that we are trying to unwind a clinician for being responsible for. Um, Under no obligation is a clinician going to be asked to call every single patient that calls them every day, right? Like I think most practices have some sort of containment model where they say, hey, we're only going to escalate things up to the clinician, ask you to call them if it's really truly something that requires your level of licensure and experience. Um, and again, when we bring enterprise telehealth into a market, we bring that layered structure that's definitely stretched more than any local brick and mortar practice can have. Because as I mentioned previously, we have medical assistants, we have LVNs, we have registered nurses, we have APPs that even sit on our team that help with inbox tasks. So we have all these layers that come before even our telehealth platform again, that we help to contain all of these additional duties that often are not billable. I mean, most of these things we talk about are non-billables. They're pain points. They're part of comprehensive and complete high quality care, but they don't necessarily need to be done by that specific clinician. So again, as we get into these markets and we start to broadcast kind of what we're going to do to help them, a lot of times we start out by sunsetting their answering service. They have a very high cost answering service that is responsible for answering their calls off 8 to 5 hours, Monday to Friday. We bring our clinical advice line team in there and we start answering those calls for them. Um, and immediately they see a reduction in call. So, like any clinician that's on call that evening, the minute we implement our enterprise telehealth model, they see an immediate reduction in call because even the answering services don't have the flexibility we do. The answering services don't have access to the medical record. They don't have history on the patient. They often are not pediatric focused clinicians for the most part, as we are. So we contain these calls at a much higher rate than an answering service would, and for a much cheaper rate, by the way, I should add, than the answering services charge per call. Um, so what does that do then? That reduces the amount of visits that sometimes go to the office. The patients are not coming in for unnecessary visits. And then again, as you go through the evolution of the VBC model, you talk about kind of beefing up panels, adding more patients to the panels, because again, we're able to offload that super low acuity stuff to enterprise telehealth and bring in patients to the office that really truly need to be seen, that need to be examined, that need diagnostics, that need treatment. And again, really provide an experience for a patient that is both convenient and high quality. Because I think the worst thing ever as a parent, I have 4 children myself, so I'm just as aware of anybody that's a parent out there listening, of the struggles that is to bring your child to the office, have a 2-hour wait, and be told that they basically have a runny nose, there's nothing you can do, and go home and make sure they blow their nose and hydrate and watch out for these symptoms for the next 2 to 3 days. It's a real pain point. Folks have to take off work. And like you said, Jeff, if you're not working from home, it can be challenging if you're working from home too, right? But if you're not working from home, that can be a real hardship. If you're like a teacher, you have to get coverage and then you have to pick your kid up from school. It's process, right? It's process. So, again, we bring that strategy into every market we go into. So there's residual positive effects on in-market hiring for both the brick and mortar clinician, because now they're seeing the value add of having this telemedicine backbone backing up their brick and mortar practice. And then as we hire folks in enterprise telehealth, we are that work from home team. We are that virtual care team that, treats very, very tight knit niche sort of symptomology. And we find that once clinicians start with us, they generally stay. They find